The Connecticut Office of Early Childhood is the state agency responsible for licensing child care centers and group child care homes. Licensing inspections are an opportunity for you to demonstrate compliance and knowledge of the statutes and regulations. During these inspections, your licensing specialist will be available to answer questions, provide agency updates, and support you in facilitating continued compliance. This presentation will help you understand what is required to maintain compliance with licensing regulations. Section 1 will discuss components of an inspection. Section 2, administration. Section 3, staffing and general record keeping. Section 4, health and safety. Section 5, physical plant. Section 6, educational requirements. And Section 7 will address under 3 endorsement, school age endorsement, and night care endorsements. Section 1 will review the licensing inspection process. The OEC is required to conduct unannounced inspections of all licensed child care centers and group child care homes at least annually. We understand an inspection may be unsettling, however, it doesn't have to be. Licensing inspections are an opportunity for you to demonstrate compliance and knowledge of the statutes and regulations. During these inspections, your licensing specialist will be available to answer questions, provide agency updates, and support you in facilitating your continued compliance. The following slides will help summarize what to expect during the inspection. Upon arrival, the specialist will introduce themselves, show identification, explain the purpose of the visit, ask for the person in charge, and answer any initial questions you may have. Keep in mind, immediate access must be granted to the licensing specialist. The designated person in charge must have access to all records, along with any information needed to complete the inspection. The children in care are your first priority, and our visit should not impair your ability to provide care or maintain compliance. Within the first few minutes of arrival, you can expect that the licensing specialist will conduct a walkthrough of your program space to verify compliance of staff-to-child ratios, group size, and assess any immediate health and safety concerns. After the walkthrough, the specialist will request specific items and records to be reviewed and conduct a more thorough physical plant inspection, which includes both indoor and outdoor space. This may also include conversations with staff, observations in the classrooms, and photographs as necessary. The inspection will be completed with an exit interview, which will include a comprehensive review and discussion of any regulatory violations identified during the inspection, and the process to complete a corrective action plan. This is a great opportunity to ask any questions you may have or get clarification on the regulations. Please understand there may be circumstances when an inspection may not be completed in one visit. The operator of the child care center is responsible for maintaining regulatory compliance related to the overall management and operation of licensed child care centers and group child care homes to ensure the safety, health, and development of the children in care. Section 2 will review some but not all of the components related to the administrative requirements. It is your responsibility to read and understand all of the licensing regulations. When you completed your licensure application, you were required to develop detailed policies, plans, and procedures for your child care center or group child care home. This included specific written plans to address the topics regarding discipline and behavior management, closing time policy, emergency protocol, supervision, child protection, abuse and neglect, general operating policies, personnel policies, and the administration of medications. It's important to remember that as the licensed legal operator, you are ultimately responsible for ensuring that these policies and procedures are implemented effectively and consistently by all members of your staff at all times. Remember, you are required to notify the parents, staff, and the agency within 5 days of changes in these policies, plans, and procedures. Regulation requires participation by all new staff in employee orientation, and it is your responsibility to assure that all current staff receive annual training on these policies, plans, and procedures. These orientations and trainings should be clearly documented and available for review by licensing staff during inspections. It's also very important that while you review your policies, plans, and procedures, you are updating them as necessary to accurately reflect current best practices and changes to laws and regulations. As the legal operator, it is ultimately your responsibility for managing child behavior within your program by using techniques based upon developmentally appropriate practice. The discipline policy you created during your initial application must clearly detail exactly how staff are expected to manage child behavior using techniques such as positive guidance, redirection, setting clear limits, and appropriate supervision. These practices will encourage children to develop self-control, self-discipline, and positive self-esteem. It is important that this behavior management policy be continuously communicated with your staff so that best practices are implemented effectively and consistently within your program. Not only is it important for your staff to have a clear understanding about your discipline policies, but the families you serve as well. Regulation requires you to document that you have discussed behavior management policies with families prior to enrollment so that they fully understand your practice. You and your staff are directly responsible for protecting the children who are in your care. Staff must never engage in or allow abusive, neglectful, physical, corporal, humiliating, or frightening treatment or punishment, and must never tie or bind children, and shall not restrain children except for the protection and safety of the child or others using least restrictive methods as appropriate. By law, you and your staff are mandated reporters and are required to report any suspected child abuse or neglect to the Department of Children and Families or your local law enforcement. An oral report must be made within 12 hours and follow up in writing on the DCF 136 form within 48 hours. The Department of Children and Families hosts a free training for caregivers that will help you understand your responsibilities as a mandated reporter. This training can be found on the DCF website. Reporting laws and forms are also provided for download on our website. In the unlikely event that a child dies while in your care or has been admitted to a hospital, you are required to notify the Office of Early Childhood no later than the next business day. However, if a child is treated but not admitted to the hospital, you are not required to contact us. Neither plans nor policies affect quality unless the program has devised a way to effectively implement them. Programs are encouraged to conduct their own reviews and observations to ensure that all staff are following the program's policies and procedures. The policies and procedures described in this presentation reflect the minimum standards required by regulation. Programs are encouraged to exceed these minimum standards in developing their own program policies. As early childhood professionals, you should always strive to provide the highest quality program for the children and families that you serve. Regulation requires that you have specific items posted in a conspicuous location that is accessible to the public, including your license certificate, current fire marshal certificate, OEC complaint procedures, food service certificate and menus, if applicable, emergency plans, no smoking signs at entrances, and radon test results. Following an inspection, it is also required that all pages of your inspection report are posted for 30 operating days. In an effort to keep parents, families, and the Office of Early Childhood well informed, you or your program staff shall notify the agency, the parents, and staff of any changes in programs or services. There are many different scenarios that may require notification of change to the agency. If you are unsure if you should notify the agency, it is advised to contact your licensing specialist or help desk to inquire. The following are some specific examples that do require notification. A notification of change shall be submitted to the agency whenever there is a change in a director, head teacher, and legal representative. A qualified and agency-approved head teacher or an interim head teacher plan approved by the agency shall be in place within 30 days of the change. Notification of changes related to the license capacity, fees, services, or voluntary closing shall be made at least 30 days prior to the effective date of the proposed change. Sometimes the program may wish to alter how they will utilize certain space within their existing facility, or may plan for renovation or additions to the facility. Such changes must be reported to the agency prior to the commencement of any changes. Parents shall have access to your program at any time during customary business hours. It's suggested that all staff are made aware of any family situations or specific circumstances that may prohibit program access or compromise the safety of others. Child care centers and group child care homes are required to allow staff of the OEC access to the program at any time during your operating hours. Unannounced inspections will be conducted by licensing staff at least annually. During these inspections, agency staff must have access to your licensed premises, records, staff, policies and procedures, and other required items necessary to complete their inspection. Your license reflects the capacity and ages of the children you are approved to provide care for at any one time. Any modifications to your license must be pre-approved by the agency. Remember, regulations state that when enrolling during the months of September, October, November, and December only, a child who will be 3 on or before January 1st may be enrolled as a 3-year-old. At any other time of the year, 3-year-olds must have had his or her 3rd birthday to be considered a 3-year-old. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist. Section 3 will review some but not all of the components related to staffing and staff record-keeping requirements. It is your responsibility to read and understand all of the licensing regulations. Choosing the right program staff is key to operating a successful child care program. The quality and continuity of the child care workforce is the main determining factor of the quality of care. It's essential that your program staff has the personal qualities to care for and work with children as well as to relate to adults and parents. Every program is required to have a designated director. The director is the program administrator or person responsible for the day-to-day administrative operation of the program. This person is required to have completed at least 3 credits in the administration of early childhood education programs or educational administration from an accredited institution. If your director has not yet completed the 3 required credits, they will have up to 1 year after the date of hire to do so. Any person designated as director prior to January 1, 2010 shall not be required to meet such educational requirements. Every program is required to have at least 1 designated approved head teacher who will be on site at least 60% of your operational hours. Individuals seeking a head teacher certification must submit their application and supporting documents directly to the OEC Early Childhood Professional Registry. To begin the process, please call or visit the website as noted. Your director must maintain documentation that they have completed the 3 required credits of training. It is not required, but you are encouraged to also keep on file your head teacher certificate. You must have at least 2 staff 18 years of age or older on site whenever 1 or more children are in attendance. Keep in mind that the number of required program staff will be dependent on your daily attendance in order to maintain proper ratio. Your program is required to have at least 1 staff member present that is first aid and CPR trained during all operating hours. If your program administers medication, you must also have at least 1 staff member present who is certified in the administration of medication when any child requiring medication is present. There must be sufficient staff on site to maintain ratio and group size for the numbers and ages of the children present at any given time. For children under the age of 3, you must have 1 adult for every 4 children and with a group size of no more than 8 children. For children age 3 and over, you must have 1 adult for every 10 children with a group size of no more than 20 children. When you combine a group of children under and over the age of 3, you shall always maintain a 1-to-4 ratio and a group size of no more than 8 children. More stringent ratios are required when children are participating in swimming and/or wading as part of the program, whether at the facility or on a field trip. Be sure to refer to the regulations for more information. Professional development means attendance at classes, seminars, workshops, conferences, or forums, and participation in distance learning activities that improve one's knowledge, skills, and abilities. Professional development for program staff must be required, equaling 1% of the total annual hours worked. Such education may include, but is not limited to, early childhood education and child development, licensing and regulations, health issues, nutrition, first aid, social services, child abuse laws, and programming for children with disabilities or special health care needs. The program shall develop, implement, and maintain a written plan for professional development in child care. The operator shall have documentation of a professional development plan for each program staff member, which shall be maintained on site at the facility and made available for review by licensing staff. Documentation of completed hours of professional development for each staff member must also be maintained on site. Be sure to include on your training logs the number of hours each staff member has completed along with the specific name of the training and trainer. Regulations require that all child care centers and group child care homes develop and implement a written plan that includes the services of an OEC-approved early childhood educational consultant, a health consultant, dental consultant, social service consultant, and registered dietitian if the program will serve meals. The selection of consultants for your program should be thoughtful and deliberate. It is also important that program staff and consultants share their philosophy and vision for the program with each other. With your initial application, you are required to submit a plan for consultative services for each of the required consultants you've selected. This plan should be clearly documented and understood by both parties. This written plan will serve as the foundation for the consultative relationship. The agreement should address all of the services to be provided. In addition to the service plan, you must maintain a log from each consultant that documents the activities and observations required, including the annual review of written policies, plans, and procedures. These logs must be available for review and maintained at the facility for 2 years. Your health consultant will be an invaluable resource to your program. In addition to the minimum service requirements, health consultants are required to work with your program on a much broader scale to assist you in ensuring the health of the children in care and provide advice on your health program. At each visit, your health consultant should be documenting required duties as reflected on the sample log shown here. The frequency of visits will vary depending on the ages of the children you serve and your program hours. A file shall be kept on the licensed premises for each employee of the child care center or group child care home, which includes a medical statement signed by a healthcare provider completed within 12 months before the date of employment for new staff and then updated every 2 years. This medical statement must document the presence of any known medical or emotional illness or disorder that would currently pose a risk to children in care or would currently interfere with effective functioning as an employee. Upon employment, a written report of a negative tuberculosis test or negative chest X-ray completed within 12 months prior to the date of employment must also be on file. This is only required upon initial hire, so remember to keep a copy on file for the duration of employment. Documentation of professional development for each program staff member who cares for the children, including new employee orientation and annual training for current staff on policies, plans, and procedures. This staff file must also include a record of any disciplinary actions. All first aid, CPR certifications, and administration of medication training certificates for employees must also be kept on file. For each prospective employee, a DCF state and federal background check must be completed, and the operator shall provide to the agency any information needed regarding substantiated abuse or neglect findings or criminal convictions. Good record keeping is essential. It is your choice how you wish to organize your records. However, some programs opt to use separate folders or binders for each enrolled child. Regardless of how you choose to organize them, these records must be completed prior to a child's start date and available for agency review upon request. You must have on file an enrollment form for each child in your care. This form includes important information such as the child's name, address, date of birth, date enrolled, and the residence, business address, and telephone numbers of the parents. It must also include the name and telephone number of the child's healthcare provider. This form must be signed and dated by parents upon enrollment and kept current. Written permissions signed by the parent shall include names of at least one person other than the parents who the child may be released to, emergency information which will accompany the child while away from the facility, permission to transport, and any activities held off-site. Always remember when transporting children, you must follow all Connecticut motor vehicle laws, including proper car seat and seatbelt use in accordance with the child's age and weight, a current driver's license, and having your vehicle properly registered and insured. A health assessment record is required to be maintained on-site for all enrolled children. The records for infants, toddlers, and preschoolers must be updated annually. For school-age children, these records must be updated according to the schedule required by the public school system. When you receive a child's health record, it's important to review it for completeness. There should be a statement about the child's general health and information about any medical or emotional illnesses that could pose a risk to other children in care or affect their ability to safely participate in your program, along with information on any known allergies or disabilities and ongoing medications. The immunization record must include the month, date, and year of each required immunization. If a child is in progress with immunizations or has a medical exemption, this must be properly documented by the medical provider and kept on file with the child's health record. A current and complete health record and documentation of age-appropriate immunizations must be on file upon the child's first day. For children with disabilities or special health care needs, such as allergies, special dietary needs, dental problems, hearing or visual impairments, chronic illness, developmental variations, or history of contagious disease, there must be an individual plan of care. This plan shall be developed with the child's parent and healthcare provider and updated as necessary. The plan shall include appropriate care of the child in the event of a medical or other emergency and shall be signed by the parent and staff responsible for the care of the child. The facility must maintain on site a written record of all injuries, illnesses, or accidents that occur on or off site as part of the child care program. A written report shall be available to the agency and a copy provided to the child's parents no later than the next business day. This report shall include a description of the injury, illness, or accident, the date, time, location, and any action taken by the facility, including but not limited to whether the child was transported to a hospital emergency room, doctor's office, or other medical facility. Child care centers and group child care homes are required to maintain records on site for specific periods of time. The time will vary depending on the type of record. To determine how long to retain records, please refer to the timeline shown here. This can also be downloaded from the agency website. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist. Section 4 will review some, but not all of the components related to health and safety requirements. It is your responsibility to read and understand all of the licensing regulations. It is your responsibility as a caregiver to provide nourishing food daily that is safe for all children in care. If your program serves meals, you must have a registered dietitian available to review menus and answer questions. In addition, you must have a food service certificate and maintain compliance in accordance with your local health department. All meals must be nutritionally adequate as recommended by the U.S. Department of Agriculture. If you provide breakfast, 3 food groups must be served. Other meals must include food from 4 food groups and snacks 2 food groups. All menus must be visibly posted 1 week in advance and kept on file for 3 months. If changes are made to the menu, they must be documented by the end of the day. In storing perishable food items that are either provided by you or by parents, you must have proper refrigeration or ice packs in order to maintain a temperature of no higher than 45 degrees Fahrenheit. If you have a kitchen within your facility, it must not be used as a playroom and must be separated by a door or gate from other program space. Your kitchen may be used for specific supervised activities. This area must also be kept clean, sanitary, with all equipment in good repair. Children and staff must wash their hands with soap and water before eating or handling food. Remember, hand sanitizer and baby wipes are not a substitute for soap and water. If you are regularly having meals or food brought into your program, you must have a food service certificate from the establishment for review. When a child is ill or injured while in your care, they are especially vulnerable and require your extra attention and care. Therefore, staff should be knowledgeable about signs and symptoms and ready to act accordingly to meet their needs. Any child showing suspicious signs or symptoms of short-term contagious illness shall be placed in a designated isolation area with continual visual supervision by staff. The parent or other authorized adult shall be called immediately to remove the child from the child care center or group child care home. Keep in mind that establishing and implementing clear illness policies will help to ensure the health and safety of all children. There are certain diseases that are reportable to the Department of Public Health. Be sure to refer to the list of these reportable diseases on our website. Your program shall maintain at least one portable, readily available first aid kit wherever children are in care, including field trips, outdoor play areas, and one to remain at the facility if all children do not attend the field trip. Each kit shall be a closed container for storing first aid supplies, accessible to staff at all times, but out of the reach of children. First aid kits shall be restocked after use, and an inventory shall be conducted at least monthly. The first aid kit must contain the items listed here. Additionally, when on field trips, your kit should also include the additional items as shown here. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist. Section 5 will review some but not all of the components related to physical plant requirements of your licensed premises. It is your responsibility to read and understand all of the licensing regulations. As the operator of a licensed child care center or group child care home, it is critically important that you carefully look at every room within your program space that is used by children on a daily basis to ensure their safety. It is highly recommended that you view each space from a young child's eye level to identify any potential hazards. Take a moment to view some of the potential dangers you should be checking for within your program space. During an inspection, the licensing specialist will fully inspect the licensed premise. The building, equipment, and services must be maintained in a good state of repair at all times. It can be difficult to keep track of all the maintenance required within all areas of your child care facility. To help you stay on track, regulation requires you to establish a maintenance program that ensures that the interior, exterior, and grounds of the building are maintained, kept clean and orderly, and are free from hazards. A clean environment should ensure that walls, ceilings, floors, and rugs are cleaned and maintained regularly. All garbage must be disposed of daily. All equipment, including but not limited to toys, cots, cribs, bedding, microwaves, refrigerators, high chairs, ceiling and floor vents, tables, chairs, and step stools, etc., shall be cleaned regularly. All broken toys and equipment must be disposed of as necessary. Any potentially hazardous substances must be stored in a separate, locked area. Additional items that your licensing specialist will look for during an inspection include but are not limited to well-maintained walkways that are clear and easily passable for entering and exiting the building, glass doors, windows, and mirrors that are either inaccessible to children or are properly protected up to 36 inches, individual storage for clothing and bedding, outlets that are protected with either plug covers or safety outlets and cords that are properly secured and meet safety standards, properly screened windows and doors when opened for ventilation, and hot water that tests between 60 and 115 degrees Fahrenheit. Each classroom must have a thermometer affixed to the wall to ensure that the air temperature is maintained at a minimum of 65 degrees. If the temperature exceeds 80 degrees, you are required to increase ventilation and provide additional fluids. Space heaters are strictly prohibited anywhere within your facility, including office space. If your program has rugs, be sure that they are secured to the floor to prevent hazards. You are required to have a working telephone on each level of the facility with emergency numbers posted nearby. Cell phones are acceptable. Spaces used by children for reading, painting, and other task work must have 50-foot candles of light. Specialists will measure the lighting in these areas using a light meter. You are encouraged to keep your own meter and periodically measure your own lighting to help you maintain compliance. Although natural light will certainly contribute to the brightness of these areas, it is not always a reliable source of light. There should never be occasions during your program when the facility has no light whatsoever, including nap times. If you can't see, you can't supervise. All areas used by children shall have light fixtures that are shielded or shatterproof. Stairs must be properly protected and maintained in good repair with handrails installed at a height usable by children. Any programs that have combustible fuel such as gas, oil, or propane shall have at least one CO detector on each occupied level of the facility. Individual cots must be provided for all children that regularly remain in care for 5 hours or longer. When cots are shared, they must be washed and disinfected between use. If you have any pets such as fish, rabbits, turtles, dogs, cats, etc. that are kept at your facility, you must ensure that there are procedures in place for their care and maintenance. Your licensing specialist will ask to see your pet care plan, so be sure you keep this readily available. Placement of furnishings should address the needs of the children for stimulation and development, and at the same time help to prevent collision and injury. Equipment and furnishings should be arranged so that a caregiver or teacher can easily view the children from different positions within the room. As the operator of a licensed child care center or group child care home, it is essential that you carefully scan your outdoor play space on a regular basis to ensure that the area is clean and safe for children. Please take a moment to view some of these common playground hazards. Outdoor play is an opportunity for learning in a different environment, as well as providing many health benefits. Safe outdoor areas encourage children to develop gross motor skills and fine motor play in ways that are difficult to duplicate indoors. During an inspection, your licensing specialist will check to ensure that all swings, seesaws, or climbing equipment has the equivalent of 8 inches of shock-absorbing material under and around the equipment. You may be asked for supporting documentation that demonstrates compliance. Your playground should be free from glass, debris, holes, and other hazards. Be sure that all nuts, bolts, and screws are tight and well protected. All outdoor play equipment must be age-appropriate, in good repair, safely arranged, and anchored for stability. Fences used to protect children from traffic, bodies of water, and other hazards must be at least 4 feet high and in good repair. If the play area is located on a rooftop, fences or permanent barriers shall be at least 6 feet high. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist. Section 6 will review some, but not all, of the components related to the educational requirements of your license program. It is your responsibility to read and understand all of the licensing regulations. In order to meet and enhance the individual needs of the diverse population of children served, which includes children with cultural, language, and developmental differences, all programs shall develop policies and procedures and implement a written plan for their daily program. The plan shall include a flexible schedule that provides enriching activities and experiences. Physical activities must provide opportunities for fine and gross motor development. You should ensure that children have creative experiences such as art and media, dramatic play, music, language, and motor activity. In addition, your schedule must also provide age-appropriate opportunities for problem-solving, language, social-emotional, and health learning experiences. The Connecticut Early Learning and Development Standards are an excellent tool that is often used by childcare programs to assist them in lesson planning and curriculum development. Here is an example of what an appropriate daily schedule might look like in a childcare center or group childcare home. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist. Section 7 will review some, but not all, of the components related to the under 3 endorsements, school-aged care, and night care. It will also direct you as to where to find more information on the administration of medications. It is your responsibility to read and understand all of the licensing regulations. If you do not already have an under 3 endorsement, which allows you to care for children 6 weeks to 36 months of age, you may apply to add this endorsement to your license. Remember, to do this requires a notification of change form along with a supplementary application for infant and toddler care that is approved by the agency. Your licensing specialist can assist you through this process. During an inspection, your licensing specialist will be looking to see that you have equipment available that is developmentally appropriate, clean, safe, and in good repair. Remember, with the allocation of your sinks, you must have those that are designated exclusively for hand washing, and these must be clearly marked and used as such. For example, a sink designated for hand washing must not be used to clean dishes, toys, or art supplies. All high chairs shall be clean, stable, with safety straps and a locking tray. You can expect that your licensing specialist will check refrigerators to ensure proper storage and labeling of food and bottles. All equipment used to heat food or bottles must be located in an area that is inaccessible to children and electrical cords kept safely out of reach. According to Caring for Our Children's 3rd edition, infants have received burns from hot water dripping from an infant bottle that was removed from a crock pot or by pulling the crock pot down on themselves by a dangling cord. Caution should be exercised when using this equipment. During an inspection, licensing staff will observe diaper changes to ensure that the posted diapering and hand washing procedures are followed. You must have well-stocked appropriate diapering and toileting supplies such as disposable paper sheets, covered receptacles, soap and water, toilet paper, paper towels, and disinfectant. Bottles of bleach and water solutions may be kept unlocked in your diapering area as long as it is located in an area inaccessible to children and prepared appropriately. All other disinfectants and cleaning agents must be kept locked at all times. According to the American Academy of Pediatrics, every year about 3,500 infants die from sleep-related deaths. 90% of cases occur before an infant turns 6 months of age. It is important to be aware that cribs to nap infants must meet current safety standards. If you have cribs built prior to June 28, 2011, it most likely is not safe for use and you must confirm compliance to the new standards. Remember to keep copies of any manufacturer documentation on file. You can find more information about crib compliance on our website. You will be directed to our child care provider's guide to new crib standards, or you may contact your crib's manufacturer directly. Regulations require that children under 12 months of age be placed on their back to sleep in a well-constructed freestanding crib or bed designed for infant sleeping with a snug-fitting mattress until they are able to turn over on their own. Infants should not sleep in car seats, beanbag chairs, bouncy seats, infant seats, swings, high chairs, or any other type of furniture that is not intended for sleep. Soft or loose bedding, including bumper pads, pillows, comforters, bibs, etc., should be kept out of cribs. If you do not already have a school-age endorsement, you may apply to add this endorsement to your license. Remember, to do this requires a notification of change form along with a supplementary application for school-age care that is approved by the agency. Your licensing specialist can assist you through this process. School-age programs are those that serve children that are at least 5 years of age on or before January 1st of the current school year and less than 13 years of age and attending school. Special needs children who attend school may be enrolled up to 19 years of age. All regulations apply to programs that serve all age groups, including school age. However, if your program serves only school-age children, then there are specific regulatory items that will not apply. Please see the document here to review those exceptions. All school-age children enrolled must have adequate opportunities for creative, recreational, and restful activities as appropriate to meet the needs of the individual school-age child. These activities shall not be an extension or duplication of the child's school day. If you choose to care for children between the hours of 10 p.m. and 5 a.m., you must have a separate night care endorsement issued by the agency. You will need to have an approved designated head teacher on the licensed premises at all times and have a written plan for program activities that will meet the needs of individual children, including sleep patterns and quiet activities. Also, a written plan must be kept on site that outlines policies and procedures to address continuous supervision of sleeping children, including cot placement and evacuation from the building. Remember, no child shall be in care for more than 12 hours in a 24-hour period on a regular basis, and it's essential that all staff remain awake to properly supervise sleeping children. Remember to follow all safe sleep procedures for all children under 12 months of age. Regulation requires that you provide each child over 12 months of age with an individual cot or crib with appropriate bedding. Remember, bunk beds are not allowed. Sleeping apparel and toiletries are required for each child and must be individually labeled and stored. Toiletries include a towel, washcloth, toothbrush, toothpaste, and soap. Bedding for children over 12 months of age shall consist of a blanket and sheet or a sleeping bag with a pillow in a pillowcase. All bedding and sleeping apparel shall be laundered weekly and as needed. To ensure the comfort of all children, the air temperature shall be maintained at least 65 degrees. If a child in your care requires medication, please note that there are specific regulations that you must follow. If you choose to administer over-the-counter or prescription medications, you must be properly trained and maintain compliance with the regulations pertaining to the administration of medications. Keep in mind that, per regulation, children with prescribed medications for asthma or allergies cannot be denied enrollment. Therefore, in these circumstances, you will be required to ensure staff training in the administration of medication prior to the child's enrollment. We hope that this section helped to offer clarity. However, if you still have further questions, you may refer to either the statutes and regulations or call our help desk to speak with a licensing specialist.